Each year, countless seniors schedule their regular medical appointments, believing they are making the best choices for their health. However, what if these seemingly harmless routine examinations could potentially increase your stroke risk within hours? This revelation may sound unbelievable, yet you place complete trust in your healthcare provider and diligently follow their guidance. Nevertheless, hidden within the complexities of contemporary healthcare are silent dangers that rarely receive proper warnings. Neither news outlets, clinic pamphlets, nor sometimes even your physician discuss these concerns adequately. Picture leaving your yearly health assessment feeling confident about your well-being, only to encounter symptoms like dizziness, vision problems, or more severe complications within days. You find yourself questioning what could have possibly gone wrong. The reality reveals that specific diagnostic procedures, particularly when performed excessively or under certain medical circumstances, may silently cause sudden blood pressure elevations, interrupt normal circulation, and potentially initiate a dangerous sequence leading to stroke. However, this information should not frighten you. Instead, it aims to educate you so you can pose more informed questions and safeguard yourself and those you care about. Once you reach 60, the focus shifts beyond merely detecting health issues early. It becomes equally important to prevent problems we might inadvertently create through unnecessary medical interventions. In the following discussion, we will reveal the 5 most frequently administered medical tests that may harbor concealed stroke risks, particularly for older adults. More crucially, you will discover precisely how to protect yourself before your next medical appointment. If you are over 60, please comment with the number 1. If not, comment with 0 and remember to subscribe to Balanced Health, where we expose information others will not share with you. Now, let us examine the first test that deserves careful consideration before agreeing to undergo the procedure. If you have ever undergone a CT scan requiring contrast material, you likely recall that distinctive warm sensation spreading throughout your body. This contrast agent performs its intended function by helping your physician visualize blood vessels, organs, and tissues with greater clarity. This process appears beneficial, does it not? Unfortunately, many seniors never learn the complete story about what that injection can accomplish beyond simply improving image quality. That seemingly minor injection can place significant stress on your cardiovascular system, especially if you are over 60 and currently managing high blood pressure, cardiac conditions, or kidney dysfunction. Some individuals experience a vasovagal reaction from the contrast dye, causing an abrupt decrease in both heart rate and blood pressure. This response can result in dizziness, nausea, fainting, or even temporary loss of consciousness. In other situations, the opposite reaction occurs. Blood pressure rises rapidly, and delicate blood vessels may constrict or spasm. When this happens, the possibility of stroke or cardiac complications quietly increases. Research published in the Journal of Vascular and Interventional Radiology demonstrated that older adults who received contrast-enhanced CT scans experienced significantly higher rates of vascular complications within 72 hours, especially those with histories of hypertension, cardiovascular disease, or compromised kidney function. Simply stated, the more compromised your system, the more hazardous that contrast dye could potentially become. Allow me to share an actual case. An 81-year-old gentleman underwent a routine abdominal CT scan following minor digestive discomfort. The scan results appeared normal, and he was discharged feeling well. However, 2 days later, he experienced a minor stroke. The probable cause involved the contrast injection temporarily elevating his blood pressure, causing a clot to form and obstruct blood flow to a portion of his brain. This does not suggest that CT scans with contrast are inherently harmful. Quite the opposite, they can detect cancers, blood clots, aneurysms, and other conditions that could preserve your life. However, the essential point remains that these scans should be utilized wisely, not simply ordered as routine screening procedures without specific medical indication. What steps can you take to protect yourself? Before consenting to a CT scan with contrast, ask your physician whether this scan is absolutely essential or if safer alternatives exist for someone of your age and medical condition. Share your complete medical history, particularly if you have high blood pressure, kidney disease, heart conditions, previous reactions to contrast dye or medications. Always inquire whether the procedure can be performed without contrast. Sometimes a non-contrast CT or ultrasound can provide sufficient diagnostic information without the additional risk. Next, we will discuss a common screening that many seniors receive even when feeling perfectly healthy, which may not be as safe as it appears. Let us now examine the stress test, also known as the exercise stress test. Theoretically, it seems like a sensible approach. You wear a heart monitor, walk on a treadmill, and observe how your heart functions under physical demand. However, if you are over 60, particularly with high blood pressure or cardiac conditions, this seemingly simple test could become dangerous. During the examination, you are required to walk or even jog on a treadmill while your cardiac activity receives close monitoring. As the speed increases, your heart rate accelerates, blood pressure rises, and your cardiovascular system suddenly experiences intense strain. For a healthy 30-year-old, this might not present problems. However, for seniors, especially those with pre-existing conditions, it resembles igniting a flame near dry kindling, potentially triggering serious complications. Some risks include dangerous blood pressure spikes, sudden arrhythmias or irregular heartbeats, and in uncommon but documented cases, small tears in fragile blood vessels, particularly in the brain. A 2020 study published in the American Journal of Cardiology examined over 1,300 patients above age 65 who underwent treadmill stress tests. The findings revealed that nearly 7% experienced harmful events during testing, including blood pressure surges and abnormal heart rhythms. The most affected group included those who already had vascular problems. This represents more than mere theory. It reflects real experiences. One of our subscribers, Margaret from Ohio, shared her experience. At 74, with long-standing high blood pressure, her physician recommended a stress test for routine evaluation. Halfway through the treadmill portion, she began experiencing dizziness and chest tightness. They immediately stopped the test, but by the following day, she had suffered a minor stroke. Doctors believed a sudden blood pressure elevation during testing ruptured a tiny vessel in her brain. To clarify, the test did not directly cause the stroke, but it introduced stress to an already vulnerable system, which tipped the balance toward complications. What should you take away from this information? Discuss options with your doctor. Ask whether safer methods exist to evaluate your heart condition. In many cases, a nuclear stress test using medication to simulate exercise, or a resting echocardiogram, may provide safer alternatives for seniors. If you are not currently experiencing symptoms like chest pain, shortness of breath, or fatigue, question whether the test is truly necessary at this time or if it can be postponed. Next, we will explore another routine test that appears harmless but could present hidden risks without proper precautions. Let us discuss something that has become extremely routine, particularly after 60, the endoscopy. Whether examining your esophagus, stomach, or colon, doctors frequently recommend these procedures as precautionary measures. Sometimes this approach makes sense. However, what nobody explains is that if you do not actually need it, especially if it involves sedation, it might cause more harm than benefit. Most people over 60 take some form of medication. Blood thinners like warfarin, aspirin, or Plavix are extremely common. When you receive sedation for an endoscopy, your blood pressure and circulation naturally change. Combine this with medications that affect your blood's clotting ability, and suddenly you face higher risks for internal bleeding or worse, brain circulation problems that can trigger a silent stroke. In 2021, a comprehensive review published in the journal Gastrointestinal Endoscopy found that among patients over 65 who underwent sedated endoscopy procedures, there was a significant increase in transient ischemic attacks, also known as mini strokes, within the following 72 hours. These were not major strokes, but they served as warning signs that something had disrupted the brain's blood flow. One case that particularly stands out involved a 76-year-old woman who underwent a routine colonoscopy with sedation. She had no symptoms beforehand, but 2 days later, she began slurring her speech and lost coordination. The emergency room confirmed she had experienced a mild stroke. Doctors believed the drop in blood pressure during sedation, combined with her daily aspirin use, may have created the perfect conditions for a clot to travel. Even when the procedure itself carries low risk, the combination of sedation, age, and medications can create a dangerous situation. This does not mean you should avoid all endoscopies, but it does mean you should not agree to one unless your doctor can clearly explain why you need it immediately. If you are receiving it simply because several years have passed since your last one, ask if safer methods exist to monitor your condition, especially if you have no symptoms. Always remind your doctor about any medications you take. Ask them whether you will need to stop your blood thinner before the procedure, what risk sedation poses for someone like you, and if you feel uncomfortable with sedation, inquire whether the procedure can be performed without it or with lighter alternatives. Next, we will discuss another test that often goes unnoticed, involving something many of us never consider: the kidneys. MRIs are powerful diagnostic tools. They help doctors see deep into your body, identify early signs of problems, and sometimes avoid unnecessary surgeries. However, when contrast dye is added, usually to obtain clearer images, caution becomes necessary, especially for older adults and particularly for those with even mild kidney problems. The contrast dye used in MR often contains gadolinium, a heavy metal. It does not remain in the body permanently. It is designed to be eliminated by your kidneys. However, after 60, kidney function naturally slows down. If you already have chronic kidney disease or reduced function that has not been diagnosed yet, your body may not eliminate the gadolinium as effectively. Over time, small amounts can accumulate. This accumulation can be dangerous. Gadolinium retention has been linked to a rare but serious condition called nephrogenic systemic fibrosis, which causes hardening and thickening of the skin and connective tissues. In the worst cases, it can limit movement, breathing, and even lead to organ complications. What most people do not hear about is that retained gadolinium has also been found in brain tissue. Some researchers believe it may cause subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in people already at risk for circulatory issues. A study published in Radiology in 2019 tracked over 2,000 patients over 65 who received contrast-enhanced MRIs. Within a week of the procedure, approximately 5% reported stroke-like symptoms including headaches, blurred vision, and balance problems. These were not full-blown strokes, but they were warning signs. Most of these patients also had underlying kidney issues, whether diagnosed or not. Harold, a 79-year-old veteran from Arizona, underwent an MRI after struggling with persistent back pain. His doctor ordered it with contrast just to be thorough. Harold had no idea his kidneys were weakened. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lingered for nearly a week. Only when his primary care doctor ran laboratory tests did they discover he had stage 3 kidney disease. He told us that no one had warned him, and had he known, he would have asked more questions. What can you do to protect yourself? If your doctor recommends a contrast MRI, ask whether it can be performed without the contrast. Often, the answer is yes. If contrast is truly necessary, request a kidney function test first. This simple blood test called a GFR can give both your doctor and you peace of mind. Also, inform them if you have ever had unusual reactions to imaging tests in the past. Remember, the MRI itself is not the problem. It is the additional chemical your body may not handle well. With proper precautions, you can still obtain the answers you need without putting your brain or kidneys at risk. Next, let us focus on a test that seems harmless and even intelligent to perform regularly, but may be directing older adults toward risky surgeries they never actually needed. The routine carotid artery ultrasound appears completely safe. It is non-invasive, takes only a few minutes, and does not involve needles, dyes, or noisy machines. It sounds like the perfect preventive test, correct? However, what most people over 60 do not realize is that if you have no symptoms and your doctor is simply ordering this scan for routine checking, this simple test might lead you down a path to surgery you never needed in the first place. The carotid arteries are the main blood vessels that supply blood to your brain. Over time, like many vessels in the body, they can develop plaque, small buildups of cholesterol or calcium. This is normal, especially as we age. However, not every bit of plaque requires removal. In fact, in many cases, monitoring it is safer than operating. Problems can arise in the following way. Suppose you receive the test and it shows some narrowing in the artery, perhaps 50 or even 60%. That sounds frightening, does it not? Your doctor refers you to a vascular surgeon, and suddenly you are being told you should consider a procedure like a carotid endarterectomy or a stent. However, if you had no symptoms, no dizziness, no vision changes, no weakness, these procedures might offer little benefit while carrying real risks. A major study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The researchers found that in many cases, surgery did not reduce stroke risk significantly more than medication and lifestyle changes. More troubling, a small percentage of patients who underwent surgery actually experienced strokes, a direct result of the procedure, either during surgery or during recovery. One story that truly resonates comes from Helen, 82, from Pennsylvania. She went for a checkup, felt perfectly fine, and had a carotid ultrasound because her doctor wanted to be thorough. It showed 65% narrowing. She was sent for surgery within weeks. Unfortunately, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She told us that she wished she had known that doing nothing might have been safer. What should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask what you are looking for and what happens if you find it. Make sure you understand whether the scan is likely to change your treatment or simply cause worrying. If you are already taking blood pressure medications, cholesterol drugs, and living a healthy lifestyle, additional tests may not change much. If you have already had a scan that showed some narrowing, do not panic. Ask about repeat scans instead of immediately jumping to surgery, and always obtain a second opinion before undergoing any vascular procedure. Let us conclude with some thoughtful advice and a gentle reminder that your health remains in your hands. The fundamental truth is that not every test is dangerous, but not every test is necessary either, especially after 60. Our bodies respond differently than they did when we were younger. What seems routine, like a contrast dye, sedative, or scan, can have ripple effects we do not always anticipate. A simple injection might spike your blood pressure. A scan might trigger an unexpected reaction. Even a quick checkup can carry risks if your system is already vulnerable. This is why it remains so important to pause, ask questions, and ensure every test fits your individual health needs, not just a checklist or standard protocol. You have every right to speak up, to ask whether something is really essential, and to request exploration of safer alternatives. Informed decisions lead to better outcomes and peace of mind. Your health story matters. Your voice matters. At Balance Health, we believe every choice should be guided by knowledge, not fear or routine habit. If you have ever felt unusual after a scan or test, or watched a loved one go through something unexpected, comment with the number 1. If not, post 0. Let us share, connect, and learn together. If this information helps you feel more aware, more in control, or simply more curious about your healthcare decisions, subscribe to Balance Health. We are here to uncover the truth, ask the difficult questions, and always prioritize your well-being above all else.